All right, good morning, everybody. All right, thank you so much for coming. Really excited about this morning. It's going to be a really nice collaboration. My name is Monica Reed. I'm a physical therapist. I own Age Strong Physical Therapy and Wellness. And we have Dr. Anita, who's going to talk to us about mental health. We have Rachel, who's going to talk about nutrition and hormones, and then I'm going to get up and talk about exercise. So if you guys have questions throughout, stop us. We'll do some movement in between each segment and a little workout at the end. So this morning is, about knowledge, it's about fun, it's about learning. So if you have any questions, stop us and we'll get to you. So I'll have Dr. Anita come up.
Hi, good morning, everyone. Can you hear me?
Yeah.
Now you can. So yes, my name is Dr. Anita. I am a clinical pastoral counselor. I own a practice in Sarasota, and I do individual counseling, marriage counseling, and trauma counseling. And so today what I'm going to talk about is our hormonal state and our emotional state and how they mesh together and work together. Okay, so so this is something that normally is not spoken about as much as it is physical health when you have this tie with emotional health with your body. But there is a thought process that your mind, your body, your emotions, and your physical self are all tied up together. So when one is not functioning well, then the other one also begins to not function well. So what I talk about with a lot of my clients is that because all of this is unspoken, people don't speak about it, it kind of just stays in the body and there's no place for it to be able to come out and to find the healing that you need. Healing can begin when we start to recognize that there is an issue. And what happens oftentimes is when we find a time when we're not feeling well, when we're feeling under the weather, when something is not going correctly in our lives physically, we tend to condemn ourselves. We tend to shame ourselves and say, why are you feeling this way? Why are you not showing up better? And that just causes more problems. So I'm here today to talk about a way to find that place to be able to get that healing and no longer condemn yourself, but find that curiosity as to why your body's behaving that way and steps you can take in order to feel better and to heal. So there is a Dr. Carolyn Leaf, and she wrote a book called Switch on Your Brain. It's a wonderful book. And what she talks about there is that it's our thoughts that actually can change our body about what we're thinking and what we're believing. So when we're busy condemning ourselves and those thoughts are constantly playing in our head, it's like a tape recorder, we end up having more physical issues, more problems. And this is what we call mindfulness. And you had shared with me the thing that you constantly tell your clients is, did you take your meds today? And it's mindfulness, exercise, diet, and then sleep. Those four things are so necessary. So I'm here today to talk about mindfulness. Okay, so my goal is to give you some insights into how the emotions, your past experiences, and your current stress levels affect your body in your season of whatever season you're in now. Maybe some of you are just starting menopause. Maybe it's not even a thought in your mind, or maybe you've already been through some of the signs and symptoms and maybe need some help with it. So I just want to ask a question. Does anyone notice any emotional or relational challenges during the season of your life? Everyone. I was going to say, does anyone care to share anything relationally or emotionally that you might be experiencing? No. Okay. All right. So menopause is not just about hot flashes or weight changes. There's more to it. But when your estrogen and your progesterone drop, you sometimes just feel like you're out of balance, like there's just a loss of balance in your life. You might get more irritable, anxious, forgetful, emotionally overwhelmed, and it's not in your head like a lot of people think, but these are actually affecting your brain and your nervous system. Then there's another hormone called cortisol, and that's your stress hormone. So if you've been carrying around emotional stress your whole life, what happens is that cortisol level stays high in your body, and it's like you're constantly in high alert. Like it's, they call that hypervigilant. Like you're always looking to see where bad things are going to happen or negative things are going to happen, and that cortisol level stays up very high. And it takes a toll on your body, and it can cause increased weight gain, especially around the belly, muscle weakness, increases your chance of injury, get tired, high blood pressure, poor sleep, mood changes, anxiety, and depression. And those are the things that happen when there is emotional stress that's carried on for a long period of time. So there is a science that's fairly new and starting to grow, and it's a body of knowledge that understands a thing called epigenetics. Did anybody ever hear of epigenetics? Epigenetics, just as it sounds. It's the study of how your behaviors, your environment, and your emotional experiences can influence the activity of your genes. So you actually have control over how your genes show up. It doesn't change the DNA itself, but it does uh, affect how your body reads your DNA, and then your genes change. So, when your mind, your emotions, your body, your spirit are healthy, your genes are healthy. So, you have healthy genes. And they show up in ways that make you look better and feel better. The opposite is also true. When you have stress, when you have past trauma, when you have emotional pain that go unaddressed, your genes can express in ways that weaken your body's defenses and contribute to illness. So you kind of like, if you've been under a lot of stress, a lot of times what happens is people get sick right after they're under a lot of stress. And it's because this epigenetics issue. And what Carolyn Leaf says is that when your thoughts are toxic, they destruct the natural flow of energy through your body and affects your health. So the energy that's inside your body with those toxins from all of this distress causes issues with your genes. So I think of my genes as light switches. So when you're under chronic stress, your healing genes get switched off. But when you begin to reduce the stress, seek support, and heal emotionally, those genes can be reactivated. So it's something like this. Oftentimes we have like skin growths or tumors or psoriasis or anything in the body where the cells divide so much. And that's because we have this tumor suppressor gene that prevents those cells from growing too much and getting, divided and larger. And so when you're under stress, that is turned off. And so the cells just start to divide rapidly. And of course, we know that can include cancer also. But on the flip side, if you begin to prioritize rest, connections, and emotional healing, those protective genes can get turned back on again. So we're really in charge of our health. There's a lot of immunodepressive disorders these days that we didn't even have years ago, like lupus, like chronic fatigue syndrome, and that's because of the stress of the world that we live in today. So there's also a school of thought that when we carry these stresses from all of our years of our lives. There's a book called The Body Keeps the Score, written by Dr. Bessel van der Kolk, another excellent book. And he talks about the body just kind of holds on to all of that trauma, and it makes an imprint on the body, and we hold it there. And so when your estrogen does decline at this stage in your life, maybe some things of the past that you have been able to deal with, all of a sudden realizing that you're not dealing as well, or you just remember things from the past. So there's more like emotional stress, crying, shutting down as you begin to remember those things, because now there's no more buffer. The estrogen was holding that buffer for you to be able to not have those things come back up. And so when the body keeps the score, it remembers those things and holds on to them. Okay, so any questions so far? Okay. Um, and one of the things too with counseling that I find is there's a lot of stigmas attached to people getting counseling. But like I said in the beginning, it's really a time for you to find like grace for yourself and compassion for yourself and just to be curious about, whatever emotional things may have happened in the past. And there's a place then for you to get healed. And so the three things that I do in my counseling work is I use a personalized and a very integrative approach. And the few things that I do, the first one, of course, is talk therapy. And so in talk therapy, you have a space to um, unpack your story, process out your emotions, and identify any recurring thoughts or patterns that could be affecting you. Some people find that when they come to talk, they're just able to connect the dots better and even come to conclusions or ways to be able to live healthier. The second thing I do is something called temperament analysis. And what I do is I give a test, and it gives a score of what your temperament is, which is your inborn tendency of how you deal with stress in the world, how you get along with others in relationships, helps you to understand yourself better and to start um, you know, having more compassion on yourself. And the third thing that I do is called accelerated resolution therapy. It's also called ART, and it's eye movements that help you move negative images from your brain that may have been there from any trauma that you may have had in the past. So if somebody comes in and like they've had a car accident and they can't, they're very stressed about driving, they come to me and I have a way of removing that from the brain through eye movements. And they get to see the negative images of that, like car crash that happened, whatever happened during it. And then I'm able to move those negative images out. So by the time they leave my office, within 72 hours after, normally their body no longer reacts negatively. So they can go back to driving, they can go back to living their life the way they could before. It works really well with people who have had abuse when they were younger. It works very well with people who have like anxiety disorders or depressive disorders. And it's just a script, I call it. It's like going to the dentist. I remove those old images and replace them with positive images, and the whole body no longer reacts. You always remember you had the car accident, you always remember those things happen, but your body no longer reacts to them. And you don't have to talk about the gory details of what happened because it's all done in your head through eye movements. It's similar to the eye movements that you have in REM sleep when you're sleeping at night. Because when you're sleeping at night, you think you're sleeping, but really what you're doing is you're organizing things that have happened in your life. So if you meet somebody one day and you have a difficult conversation with them, or you had to tell them something that you couldn't think of, when you wake up in the morning, sometimes you're like, oh, now I know what I should have said, or now I know how to deal with that problem. And that's because at night with your REM sleep, you're actually organizing. It's like you have a file cabinet in your head, and some of the files are sticking out from things that happened during the day. And you kind of organize it at night and put everything back in order, and you feel better. Well, if you've had past abuse or past issues, those files stay sticking out your whole life. They won't go down, but I help them to go down. So I've had some very interesting cases of people who have had some tremendous childhood issues that after 3 sessions, they could not believe that they no longer had that negative reactions in their bodies any longer. And they're like, can't believe that that's what happened. So, but it's true. It's one of the greatest things that I've ever been able to experience. And I just love it because people don't have to relive by sharing all the things that happened to them over and over again. I just need a general idea. And throughout the entire session, they don't even need to talk much. They don't even need to tell me what's going on in their head. I just have to give direction to them, what they need to be thinking about or what they need to say. And it's really been such a tremendous tool for healing. So That's it. If anyone has any questions? Yes.
What was the name of the first book that you mentioned?
Switch on Your Brain. Yeah, Carolyn Leaf. She's written quite a few books. She's excellent. Anyone else? Okay, thank you very much.
All right, thank you all for coming. How many of you have ever owned a car and it's one that you just hold on to rather than trading in for a newer model, and you own it maybe, I don't know, 8, 9, 10 years, and then things start to go wrong? Anybody have this experience, right? Things start to go wrong. They're not made to drive forever, and neither are our bodies, unfortunately. So what I'm going to talk about today is a little bit about longevity. And the truth is, none of us are going to live forever. We are all eventually going to come to the end of this, one short, sweet life that we have. The work that I do with my patients is helping them optimize so that we can lengthen our health span. That is, the number of years that we are robust and healthy and able to do the things we love, engage in the things that we want to do, have a meaningful existence, and shorten that span that unfortunately is all too long. If you look around at how aging happens, you don't have to look very far to see that we're often not doing it very well in this country. And statistically, women are going to spend longer in that period of disease and ill health before our death than men do. And it's an interesting statistic. Um, Men do tend to die of um, things like cancers and massive heart attacks more often than women. So perhaps that's actually a grace to them. Like they just go out with a bang, and often we see that women will tend to linger in a disease state, needing long-term care and assistance with our daily activities. So I'm Rachel Smith. I am a doctorally prepared, double board certified nurse practitioner, and I own a practice just down the road off State Road 70 called Aspect Wellness. The work that I do with my patients is really just around that cardiometabolic and hormonal adjustments that we can make to optimize our health for the long term. So I'm going to give you today 5 areas of focus, and some of them I'm going to just really skim over because Dr. Anita touched a lot on kind of the emotional aspect of our wellness. And of course, Monica is going to talk in depth as she's our expert on the physical aspect. But you'll notice even in the areas that I do discuss that there's a lot of overlap. And that's the beauty of it, really. When we take a comprehensive approach to our health, everything is interlinked. And so I'm going to go through 5 things that we can focus on to really optimize our longevity for the long term. And we we started having this discussion about this collaborative event talking about thriving through menopause. But the truth is, menopause is really just this one stage of life that women go through where maybe for the first time we feel our mortality. We have that really obvious change in really our ovarian capacity to produce estrogen, and suddenly we realize, wow, I'm getting old? Like what's happening? What does this mean for me? But menopause is just this one little marker in our lives as women, and yet we've got years, decades for most of us, decades that we have to live and thrive. And so that's what we're really talking about, is how are we going to make the most of these years, and how can we optimize in these decades of our life to have the most robust health. So we're going to talk first about muscle. And I'm going to not spend too much time here because this is Monica's area, but From a cardiometabolic perspective, muscle strongly, strongly correlates with our longevity. So people who enter their fifth decade and beyond carrying more muscle mass on their bodies will tend to have lower incidence of all the chronic diseases that we develop in the US. So lower incidence of cancers, diabetes, and heart disease. And that correlates with muscle. So how do we support muscle? Well, there's two obvious things, and then a third that's not so obvious. And this is where we get some overlap. The first one is we have to use the muscle. Muscle requires resistance. So that is primarily strength training. And that's where, for women, I think many of us came of age in an era where that was not something we did. In fact, a lot of my patients still tell me, I don't really like to sweat. And so we have to talk about that, right? It's not just the sweating, but it's we've got to use our bodies. And we've all heard the phrase, use it or lose it. And the truth is, I mean, that is true not just about our muscle. It's so many parts of our body and aspects of our body. We have to use them or we will lose some of the agility. So muscle is preserved through movement and lots of different types of movement, strength training, as well as agility training, squat training, the high knees, flexibility, balance, all of that comes down to muscle. The more core muscle you have, the better balance you have, which means less likelihood of fall. The other fascinating thing about muscle is that it tracks hand in hand with bone health. The more muscle you have, the stronger your bones are. And there's almost nothing that is more devastating for me as a practitioner than to see my patients develop osteoporosis and how debilitating that can be. So if you know someone, that you're close to that has osteoporosis, you've seen this, and it can sometimes progress so rapidly, and the deterioration and quality of life impact is so great. So muscle isn't just about, can you pick up your grandchild or carry a bag of groceries into the house, but it's also how strong are your bones and how likely are you to fall or sustain an injury if you fall. So the movement is part of it, but the nutrition is the other piece of that that's obvious. You've got to fuel your muscle to maintain or grow muscle. And many, many women who come into my practice come in initially to talk about weight loss. Because what do we do if we're women? We diet. I don't know, most of my patients have been dieting for most of their life. And it doesn't matter what their weight is, they're usually on a diet of some sort, um, which in many ways is heartbreaking. We are intelligent, creative, very capable beings, and we spend so much energy in our lifetimes just fussing about that number on the scale. So that's, a lot of the work I do is help my patients, just put that aside. We're going to focus on the health aspect, and we're going to check that off our list. But nutritionally, if you've been dieting your whole life, often what we see is a lot of metabolic slowdown. So women who are maybe only eating 900 or 1100 calories a day, which I don't know whether you track calories or not, but if you're a woman, you probably do. That's a really low number. And yet they're worried about their weight. So they're not losing, sometimes they're gaining even on 1100 calories a day. So muscle equals metabolism. The more muscle you have, usually the stronger and more robust your metabolism. The more muscle you have, the more cheesecake you can eat, right? Like, how beautiful is that? I think it's a good thing. Okay, so we will talk more about muscle, but the third thing that is kind of the not so talked about element about maintaining muscle is estrogen. So for those of you who are in a phase of life where you're still a candidate for discussing whether estrogen might be something that would help you, estrogen is growth promoting in our bodies. So when we have estrogen, it is much easier for us to grow and maintain muscle. And when estrogen drops dramatically, when our ovaries shut off at menopause, suddenly women start to lose muscle, and the rate of decline is rapid. So we see muscle loss at like 2 or 3% sometimes per year of your total muscle. So this can really rapidly become a slower metabolism, which is why so many women start to see some weight gain around the menopausal transition. So estrogen is not a cure for low muscle mass or slow metabolism or weight gain, but it can be part of the preventative package that we put together. That's muscle. The second one is metabolism. And you can see I've already mentioned the word metabolism a couple times. There's so much overlap here. But when we're talking about aging healthfully, we have to talk about metabolism. How many of you would say, I have a really fast metabolism? Anybody here? I have a really fast metabolism? I, I know almost no women who would say that. I know a few men, and they're usually in their 20s, and they're trying to bulk up, right? And they can't. They're eating everything in sight, and they're scrawny, and they're trying to grow muscles. They have a fast metabolism. But most people would say they have kind of a slow metabolism. We sort of feel that. It goes hand in hand with the fact that we've probably been dieting and underfeeding, undernourishing ourselves for most of our lives. So if we want to talk about a healthy metabolism, what we're talking about is a metabolism that is based on that muscle that we have grown or preserved. Because when you think about muscle, I want you to think about the fact that it is what moves your body. It is the engine that moves your body. If I take a step, or even if I'm just standing here, everything is being held up by these large muscle groups in my core, right? Every tiny muscle up my spine and in my neck is helping me hold my body upright. So the more muscle you have, the more calories your body requires just to stay alive. The more muscle you have, the more calories you burn even when you're asleep. So, and I use this language specifically when I'm talking to women because I know it resonates with us because we've been dieting our whole lives. And so we kind of like that idea that we're burning calories even when we're asleep. But the truth is, that's also the mark of a healthy metabolism. And if you have a healthy metabolism and you do not have a great deal of excess visceral fat, fat in and around your organs, peripheral fat is okay. Like peripheral fat is what gives us our booty and insulates us and protects us if we fall. Okay? Peripheral fat is good. Peripheral fat makes some women look voluptuous and some really athletic women look not so voluptuous, right? I mean, different body types. But peripheral fat is not the unhealthy fat. It's the visceral fat that is unhealthy metabolically. Okay, so when we're talking about metabolism, the more muscle we have, the less likely we are to develop visceral fat, the less likely we are to develop diabetes as we age. The less likely we are to develop diabetes means less likelihood of cancers and heart disease, because those three are like the three musketeers. They hang together: diabetes, cancer, heart disease. And what have they named Alzheimer's? Type 3 diabetes. Okay, so we can really say it's a little team of four. These are the things we're trying to avoid. And it really does come down to, real basic stuff like how much muscle do you carry into your later years? Okay, so we're going to move on from metabolism to talk about hormones briefly. How many of, we don't have to ask this, you're either premenopausal, that is, you are still having monthly cycles, or you are postmenopausal. You have stopped having monthly cycles. Okay, it's this line in the sand, right? And it's marked by the date of your very last period. That's how we mark it in healthcare. But the years leading up to that very last period are very tumultuous for many women, not for everyone. So when we talk about the menopausal transition, 15% of women will skate through and they have their last period and they're like, thank you, Jesus. I put that behind me. I don't have to deal with that anymore. And, let's just move on with life. 15% of women are absolute dumpster fires during the menopausal transition. They feel like they've been hit by a truck. They hurt, they have brain fog, they're developing high blood pressure and high cholesterol. Their moods are all over the place. They have dry skin, they're losing their hair, they're being diagnosed with frozen shoulder and osteoarthritis and like all of the, this long laundry list, because the truth is we have hormone receptors in every cell in our body. And when we suddenly have zero estrogen and our progesterone levels drop too, our sleep is affected, our mood, our cognitive function, our joints, everything in our body is affected. So when I'm talking to women about whether or not they want to replace hormones, we talk about what do they think they know about it. There's a lot of fear out there around hormone replacement therapy and cancer. That's a very individualized discussion, but most of those fears are based on a very flawed study that came out in 2002. So if you have questions about that, ask me about it later. The truth is, estrogen does not cause cancer. It never has. It does not. So if that is a fear, I will tell you, it's become embedded in our culture. Most women believe it to be true and maybe even have heard it from their doctor. But estrogen does not cause cancer. So we can talk more about that. Hormones, when they decline rapidly, we feel it. We feel it. And there are options for replacing it to help us kind of push back some of those things. The truth is, there's nothing about hormone replacement therapy that's going to make you live forever. And you're not going to look 30 because you're on hormone replacement therapy when you're 60 or 70, but it can help push back. It can help kick the can down the road, is how we say it in medicine. So that, if you are replacing those hormones, maybe you're not going to have the joint deterioration. We know lower risk of osteoporosis. If you are feeling more on top of your game, if your mood is more stable, and maybe you're having more social interaction, maybe you're more motivated to get to the gym, there's lots of trickle down positive effects from that. So again, we can talk more about that because it needs to be a really individualized discussion. So we talked about muscle, we talked about metabolism, we talked about hormones. The fourth thing is recovery. So we hit 40 and most women are peak of career, may or may not have children who are middle school to college, or going through lots of life transitions, and aging parents. And now we've got hormones that are wreaking havoc in our body. So lots going on during this era, and it doesn't stop, right? Like we get to 50 and now we've got kids in college and parents that maybe are looking at long-term care and decisions we have to make around that, and lots to balance. Stress tends to be really, really high. And if your health is not optimized during this time, those stressors have much more of an impact. And so, a big part of the conversations I have with my patients are, how do we give our body downtime? What does that look like? What is stress management? And it has to come down to sleep. We have to learn how to sleep. And there are tools for that. I wear an Aura ring. How many of you wear some type of a sleep tracker device? It's a great tool for learning what your body needs to optimize sleep. There's other tools. Um, we have to talk about, like, are we overusing alcohol for stress management? And we live in Florida. Of course we're overusing alcohol, right? That's just culturally endemic, right? So it's a conversation that needs to happen. And listen, I don't ask my patients to give up their wine or their Thursday afternoon cocktails with the girls, but we have to look at how it's impacting our overall health, our weight, our metabolism, our cognitive decline, and our sleep. And then we have to, when we're talking about recovery, we're talking about, what does our social network look like, right? Because if we're going to age optimally, we need those social connections. This is probably one of the reasons that women live longer lives than men, because we tend to have more girlfriends. We tend to have kind of a circle of people. We've got, that surround us and they have our back, right? We can call them and they're there for us. They're going to bring us coffee. They're going to help out when we're sick, or they're going to help out with, whatever major drama is going on in our life. And men don't tend to have that. Super important. So these social connections are a big part of our long-term health. And again, as a nurse practitioner who helps my patients take a comprehensive look at their health, these are discussions we have. The final one is purpose. And purpose is a really interesting discussion when when my patients reach retirement, because we know what our purpose is when we get up every morning and we go to work. We know exactly what our purpose is. We know what our purpose is when we have kids at home. We know exactly what we're up to. We're trying to get them out of the house, by 18, alive still, and, ready to go play an important role in the world. But when the kids are gone and we're retired, suddenly that purpose is a little wobbly, and we may need to find our true north again. So, it's interesting because when I'm working with my patients who are gearing up for retirement, it's super exciting, and you feel this sense of like the world's going to open up for you and you're going to have all of this time to do whatever you want. And what I see is very frequently I've got new patients coming to me and they've been retired for 2 or 3 years and they're like, I've gained all this weight. I don't really do anything. My sleep is so disrupted. I sleep till 11. I'm up till 2. They don't have a schedule. They don't know what they're up to anymore. And so, having a purpose driven life, whether you have a job to go to or not, is super important. And in all of the longevity studies, this is one that tends to rise to the top, that we need to know what we're up to each day. So I think that's a pretty important one as well. So we talked about muscle, metabolism, hormones, recovery, and purpose. And this is the work that I do with my patients at Aspect Wellness. Thank you for listening. Does anybody have questions? No.
I was going to ask you,
Yes.
what is the average age now of menopause?
52.
So 52.
Yeah.
So usually 52 is when the cycle.
That's typically the final period at 52, but perimenopause can start as early as 12 years prior to that. So 40 for some women, if they're going to enter menopause at 47, they're in perimenopause by 38. Yeah. Yeah, so it can be pretty disruptive at a time of life when you really don't need that. You really don't have time for that. Yeah. All right. Thank you so much.
Thank you.
All right, so my name is Monica. I'm a physical therapist. Work with an active aging population. I do physical therapy, run group classes that are kind of geared towards the 55 and up community. So I have some wonderful pictures of my classmates. So we've been running that for a year, and they're all doing really, really great. So super fun. All right, so a lot of the stuff that I have up here, we've already discussed. We've talked about estrogen declines through menopause, and that has a negative impact on our muscle mass, our bone density, and our metabolism. We commonly see fatigue and joint pain and mood changes, poor sleep. But the good thing is that exercise can kind of treat all of that. So like exercise is a major form of medicine for this time in our life and beyond. I got myself a little out of breath with the 30 seconds of this stand, which is good, but I'm like, oh, where's my breath? All right. Okay, so as everybody mentioned, the strength training is a super important part. We have that muscle loss as we age, but through studies over the last 20 years with masters athletes, we know that we can actually stave off that curve. So what we traditionally thought was this like decline in our strength, going past a point of being able to maintain our independence. We thought that was just like a normal course of aging, but over the last 20 years, we've watched these master athletes maintain a really high level of independence and strength. So through strength training, we can stave off that curve. And so like, again, the strength curve staying up and then dropping down. So like Rachel said, like we don't spend a lot of time, we can avoid that time frame where we're not able to be independent in our home. And any bump up off that curve, that's independence. That's you living life with your family, enjoying your grandkids, golfing, playing pickleball, hiking, dancing, traveling. That's all the things like, why do we do what we do? It's so that we have that higher quality of life. So taking that base level strength and increasing as much as possible, that helps us maintain that quality of life. It also helps us maintain our bone density. So exercise, weight training will pull on our bones. The stomping that we do through some of our exercises, it builds up that bone density, and that's very protective between the muscle and the bone density. If we do experience a fall, we know that about a third of adults of all ages are going to fall. How many people have had a fall in the last year? I actually have. So the stronger you are and the better your bone density is, you may still fall, but you're able to recover from that fall. You can get yourself back up. You didn't injure yourself. You avoided a hospital visit. So it's very, very protective. Muscle actually helps with diabetes, like we talked about with in the last conversation about metabolism. As your muscle pumps, it's pulling the blood sugar out of your blood, and people who are diabetic will over time not need as much insulin, and people who are not yet diabetic may prevent the diabetes from happening altogether. So that muscle is very, very protective for our metabolism. And again, that's going to help support our weight and our energy. So from an exercise standpoint, we want to focus on compound movements. And what that means is that we're doing exercises that use a lot of our muscles, not just like a bicep curl here, but I'm going to do a full squat where I'm using all the muscles in my legs. Or maybe I'm even squat and pushing something overhead. So now I'm using my whole body. So we can do different exercises that are going to use all of our muscles at once instead of just spot training one muscle. We need progressive overload. You can't just have people using 2 and 3 pound weights for the rest of their lives. They won't see that change. We've got to start progressing and using heavier weights. So a lot of times in my classes, we're going through and it's like, okay, let's try this one. Let's switch this out. Let's make this a little harder because we're trying to progressively overload over time. We're trying to get those muscles stronger and build and make you more resilient. Intensity. Intensity is probably one of the most important, intensity and consistency. I like to give people a scale. I say on a scale of 0 to 10, 0 being I'm sitting on the couch doing nothing, and 10 is I'm working so hard I can't continue. What I'm really shooting for is people to get up to a 7, 8, 8.5 on that intensity scale. You need to feel like you're working. It can be for short bouts, but I need you to feel like you're working. And that scale is going to be very individual to each person. My 7 or 8 out of 10 is going to be different than your 7 or 8 out of 10. And that's how we can start scaling things and making things appropriate for each individual. And then consistency. You have to show up on a regular basis. You can't work out once every couple months and say, well, I work out and get the benefits of the exercise. It's got to be consistent. We're looking for at least 2 times a week of working all of the muscles in our body. All right, and again, there's real life benefits. With functional training, I'll do a little video on the next slide. We're looking at, can you lift up your grandkids? Can you get up out of a chair? Can you get on and off the floor? Can you carry your dog food in and out of your house? So we want to try to keep what our requirements are for our daily living and make sure that we are way more robust than that, so that we can do all of the things that we want to be able to do without risking injury or decline. Yeah. Any questions so far? Nope. Okay. All right, so aerobic capacity and functional fitness. As we talked about before, as estrogen declines, so does our risk of heart disease. Heart disease is still the #1 killer of women, so we can work on aerobic capacity and aerobic training to help decrease that risk. So aerobics is you're walking, you're biking, you're swimming, you're dancing, things that are going to get your heart rate up and keep them up. This is going to support brain health. It supports your mood and anxiety. You can kind of see where all these overlapping concepts from the whole visit today. It helps our metabolism. You can work on a steady state and just try to do something for 30 minutes straight, or you can work in intervals. We have a lot of really great research over the last several years that has been geared towards our older adult population, really working on getting the heart rate up, keeping it up, and then taking a break, and getting it up and taking a break. So we work in intervals to try to get the same or better benefit than just a steady state. So here, this is a really fun video, and I talk about functional fitness and making this meaningful. It's going to, unfortunately, give you a little, of course, it's going to give you a commercial first, but go big. Why aren't you going big? My son would know how to do it. Make it bigger. That's okay. All right, so here we're working on a deadlift. Now we're working on a carry and a step up, pulling something up, putting it over our head, getting on the floor, pick something up. This lady's had 2 hip replacements too. Squatting down, feeding the dog. So again, you can see where the activities that we do, for those of you who have been in class, are highly relatable to the activities that we do in daily life. So if, whoop, stop, no. So again, that's when I mention functional fitness, that's what I mean. We want to train for our daily lives. We want to build the most robust version of ourselves for what we need to be able to do on a daily basis. All right, so exercise guidelines for older adults. We are looking for 150 to 300 minutes of moderate intensity exercise per week. We can bring that down a little bit by bringing the intensity up. So if you're doing high intensity aerobic activity, you can do it for 75 minutes a week. So, and again, that's over a course of a week. So think about, 15 minutes a day if you're working at high intensity, and 30 minutes a day if you're working for a longer period of time. And then strength training, again, with those compound movements, working our whole body at a minimum of twice a week. So that's what we're looking for. And I'm also going to talk about recovery. As we age, recovery becomes a bigger deal. We don't bounce back as quickly as we did when we were 20. Already noticing that in my 40s. We do need to make sure that we're taking even a few days a week that we're not doing high strenuous activity, doing some more stretching, doing relaxation, deep breathing exercises to kind of help and avoid those high stress and overuse injuries. So we like to work on balance, we like to work on mobility. There's also just this awareness of the pelvic floor. Some of the barriers I run into with my older adults when it starts looking at impact or working into exercise is I've had 4 kids. Things don't stay up. If I start jumping, I might leak. But your pelvic floor is a group of muscles just like the group of muscles in your legs. And as you strengthen your whole body, that pelvic floor will get better. And as you challenge the pelvic floor, it will get better. But it's a gradual process, right? So somebody who's just had a baby isn't going to be able to do a lot of jumping and maintain their pelvic floor. But as they get stronger and recover, you will be able to get back to some of those higher impact activities. So just it can be a barrier to entry. So just being aware that we can start things at a low impact. As you get stronger, the intensity can improve because now you've challenged that pelvic floor and it's gotten stronger too. So, and this is just another, vaginal estrogen has become a very big help in this arena as well, with helping the quality of the bladder and the quality of the muscles around the pelvic floor as well. So this is just another way where we're talking about hormones. Vaginal estrogen has been very, very beneficial in this area, and is being used all the way up to women in the nursing home not getting out of bed. Like, it can be very protective against UTIs. And so it's just a different, like, it's a newer concept that's out there. So just, again, talk to your nurse practitioner, talk to your doctors, because that can be something, if you're not using, that can be very, very beneficial. So I just wanted to throw that on there as well. So again, overall, like, we want to encourage strength, not fear. You will have a very much more robust, healthy, and fun existence with more strength. It's so protective. So again, we just want to make it fun. We want to make it enjoyable. And the better you feel, just everything else goes up against it. So Anybody have any questions for me? Okay, so I have one more exercise. One more set of exercises. I can't let anybody come out here without having a good workout. We're gonna do, I will get music going for this one, I promise. We're gonna put stuff away. We're gonna do a 6-minute AMRAP. An AMRAP is as many rounds and reps as possible. So we're gonna start off with 20 jumping jacks, and kind of talked about this with the pelvic floor. So wherever you are, whatever is best for you, you can either do a full jumping jack, we can do a half jack, or if your heart rate's getting too high and you're not comfortable with that, we can do a punching jack. So just kind of different modifications for where you are. I'm going to turn the AC back on as well. The next exercise, you'll go right into it, is either 10 air squats, or we'll go back to that sit to stand. We'll keep some chairs out so you have it, and I have a couple boxes out. And then we'll do 5 push-ups. We can either do push-ups at the wall here, or I have a bigger box. I can set it up. We've got the boxes. If somebody wants to get on the floor and do push-ups, they can. And then what you do is just start right around. So that's round 1. So then you go right back to the top to your jumping jacks. Then you do 10 more air squats, and then 5 more push-ups. And we're just going to circle through that for 6 minutes and see how many rounds you can get. Okay? All right, so we'll take a couple minutes here. We'll get the room set up. I'll get the music on, we'll get the AC on.